So good morning, everybody, and welcome to today's virtual session with the Ottawa Board of Trade, where we're going to be exploring the WSIB Health and Safety Excellence Program with Tyler Beauchamp. My name is Lynn Ladd, and I am the Manager of Programs and Membership with the Ottawa Board of Trade. Our mission is to create prosperity through advocacy, collaboration, and leadership, and we do that by bringing programs and other special events to our members. And so this particular event was of great interest to us because there's a few opportunities for Ottawa businesses here. First and foremost, number one, to have a healthier and safer workplace, which leads, of course, to greater prosperity because you're not going to have downtime. You'll have a nice, safe workforce. But also remember that during the COVID pandemic, creating confidence in your workplace is very important for business owners to ensure that your staff stays healthy and well, and that they know that they can come to work and that their well-being and health is being looked after. So this is a great time to explore this program. And it's also a potential money-saving opportunity for you as well. So we are delighted to be bringing this to you today. Our presenter is Tyler Beauchamp. And Tyler, I am going to turn it over to you. Are you all set?
Well, thank you. I'm ready to go. Thank you so much, Lynn. And thank you, everybody, for taking the time to come onto the webinar today. I know how busy everybody is. So if you just bear with me, I'm going to share my screen here. Lynn, can you just give me a thumbs up to let me know that you can see the screen?
Yep, you're good.
Perfect. Sounds good. Thank you. Okay. So let's get into it here. So again, yes, so as Lynn mentioned, we're here to talk about the Health and Safety Excellence Program, the features and benefits to you as an employer, and then we'll have some time for question and answer. Now, since Lynn had mentioned, there's only a few people on the line today, so I would prefer this to be a discussion rather than me talking to a screen. So if you do have any questions, feel free to use the hands up feature, type in the chat, or jump on and we can chat and have a conversation, okay? So a little bit about me. So my name is Tyler Beauchamp. I am a Health and Safety Excellence Consultant with the Workplace Safety and Insurance Board. I've been at the board since 2008, worked a variety of roles, started in case management, serious injuries, fatalities. I helped develop the mental health program at the WSIB. And then recently, I've been working directly with employers, helping them to develop health and safety management systems and return to work programs. I have an undergraduate degree in behavioral neuroscience, psychology, and then a master's degree in behavioral neuroscience as well, and health and safety certification. I'm a member of the Canadian Society for Safety Engineers and the Society of Ontario Adjudicators and Regulators. So by way of agenda, today's session will take about an hour. We'll definitely get you out within the hour. We're going to talk about, obviously, the Health and Safety Excellence Program. We're then going to talk about specific COVID-19 issues and how the program can help you address COVID-19 and future pandemics, especially the echo pandemic of mental health that is coming. And then we've got some resources for you. Like I said, at any time you have questions, please feel free to jump in. Okay, so to get right into it, let's talk about the current state of things right now. I think we can all agree that right now health and safety is top of mind, priority everywhere you go. Unless you're planning on leaving the planet, I think there's no way to do that. I don't think there's any way that you can escape COVID-19. Anywhere we go right now, you go shopping, you're gonna see health and safety signage. That wasn't like this a year ago. You have to remember to be physically distanced, wear your mask, use hand sanitizer. We're also acutely aware of how others are perceiving our actions towards health and safety, whether as we're individuals out and about or as a business owner operating through the pandemic. In fact, as an employer right now, you have to, by law, ensure confidence of your employees and ensure your customers are engaging in health and safety practices. So you have to have a pandemic response plan now. So we'll talk about that a little bit later. And this is the reality that we're living in right now. What does the future look like? I think that the pandemic, and I think most people would agree with me, brought about a culture shift. We have seen this before with major world events like 9/11 and the 2008 financial crisis. These were events that helped shape society. Some of you may have heard Dr. Theresa Tam a couple weeks ago, or maybe read the CBC News article that said, even when we get a COVID vaccine, it's not going to be a silver bullet. And in fact, the government is actually planning for the next 2 to 3 years of managing through this pandemic. Dr. Tem also suggested that physical distancing and masking would likely be in place for the next 2 to 3 years. So this creates even more of an opportunity for the current reality that we're living in to become normalized in society. The pandemic also created a wake-up call for businesses. Companies are now looking at ways to protect themselves against the next outbreak or emergency, and this includes a few things. For one, thinking about having insurance coverage for your losses. So beyond WSIB coverage for protection of your workers, businesses need to think about business interruption insurance. In fact, pandemic policies are expected to be the next big thing in insurance, and in order for you to get that type of insurance, most insurance companies are expecting businesses to have emergency management and health and safety programs in place if they want to get that type of insurance. The pandemic also exposed vulnerabilities in supply chains for many businesses. We know that businesses are struggling to secure supply contracts. And when you are securing contracts, you also need to demonstrate health and safety plans and prepare in advance. The Ministry of Labor has also increased the number of inspections. We'll talk about that as well. They increase the powers of inspectors and what they're looking for. And like I said, businesses need to have in writing now those pandemic plans and responses that if the Ministry of Labor inspectors come on site, they're going to want to see those in writing. I talked a little bit earlier about that pandemic echo that most people are expecting. So the Canadian Mental Health Association concluded in a study a couple of weeks ago that Ontario's perceptions of mental health has drastically changed throughout the pandemic. 7 out of 10 Ontarians, or 69%, believe that the province is headed for quote unquote a serious mental health problem as we emerge from the pandemic. And nearly 8 out of 10 people responding to the survey said that they are concerned about going back to the workplace, from moving from a home office or back to the workplace. And 1 out of 2 people actually right now have some type of mental health concern. We're going to see this huge mental health crisis coming up. And how do we as employers prepare for that mental health crisis? How do we maintain resiliency in our employees? We'll talk about that. We know now that Ontarians are consuming more substances now. So because of the pandemic, alcohol use, tobacco, cannabis, all of those uses have gone up on average about 23%. But what's more concerning is that people are using substances at different times of the day now. So as an employer, this is going to create challenges, substance use at the workplace, or what do you do if one of your employees is intoxicated? So we need to be mindful of that. So that's basically why it's important to think about health and safety and how the Health and Safety Excellence Program can help employers. So some of you on the line, and I'm sorry, I don't know where everybody, what businesses you're in, and if you want to chime in and tell me kind of what industry you're in, then we can talk about industry specific recommendations. But some of you on the line, when you hear health and safety excellence, the first thing that I get back is, do I need to be in a place of excellence to participate in this program? And the answer is no. So we're going to talk about how the Health and Safety Excellence Program is designed for all employers, whether you're just getting started or you already have a health and safety management system in place, whether you're small business or large business, you can take advantage. Now, you may have heard of some of the WSIB's previous incentive programs. So we had 3 programs before. We had the Small Business Program, the Work Well Program, and the Safety Groups Program. They were okay, but they had some pretty rigid criteria. There were tight deadlines. You had to have a pretty heavy administrative side of things, and employers really didn't take to those programs. The financial incentive to those programs was okay, but it wasn't great either. So when we were creating the Health and Safety Excellence Program, we did reach out to employer state groups to say, what do you want back from us? What are you looking for in an incentive program? And at the same time, what are your health and safety challenges? So I encourage you right now, as we're on the line, think about at your workplace, what are your challenges? So just take a second, what are your challenges when you're thinking about health and safety? And what we heard back was sort of this common theme, these 4 common responses. So first, oftentimes we heard that the person who's got the portfolio for health and safety, especially in small businesses, may not be a health and safety professional. Oftentimes we know it's HR or the accountant that just sort of takes on the role of health and safety, and maybe WSIB issues in general. But if you're not a health and safety professional, if you don't know all the regulations and legislation, how are you to build a management system that meets those minimum legislative requirements? We also heard back that oftentimes, again, those smaller businesses, those micro firms, they don't have the time that it would take to invest to really build a comprehensive program. What they're looking for is something out of the box that they can follow start to finish, and that it's not going to be cost prohibitive, right? You may not have the budget to invest in a health and safety program. There's a lot of information on the internet right now. What's applicable, what's not, where do I go to find the tools? I don't know what applies to me or not. And then finally, how do I maintain my employees' engagement? So what we're seeing right now is COVID fatigue. So maybe your employees are already relaxing on some of those physical distancing rules. Maybe they're not masking properly. Maybe you have a culture already where, you know what, it's been this way for 60 plus years. We've never had a claim. Why do we need to change things now? How do we change the overall culture and get our employees engaged? So we're going to talk about all of that. So the Health and Safety Excellence Program was designed with these ideas and more, and how we can help. So you're going to see across this slide, you know, there are 6 quadrants in the slide. It's a pretty heavy slide, but you can see here that the program is based on 36 different health and safety topics. So another word for topic might be module, or in-service if you work in healthcare, or area of improvement. So we have 36 different areas that an employer can choose from to build a comprehensive management system. We've built in recognition to the program, both financially and non-financially. So for the first time ever, we're going to publicly recognize those employers that do participate in our program. We'll talk about that, but it's a way for you to show your employees and the public your commitment to health and safety. When we developed the program, we developed it with the pandemic in mind. So we launched this program in November of last year. We knew that the pandemic was coming out of out of China at the time. So we built in pandemic readiness materials that employers can choose from to help them operate safely through the pandemic. Either you're just reopening as part of phase 3, or you've maintained your business throughout the pandemic. We have recovery roadmaps that I will share with you after the session. These are interactive roadmaps that will ask you specific questions depending on where you are in the pandemic. Either you have not yet opened, or you are opening now, or you've maintained your business. It'll ask you specific questions like, have you thought of XYZ? And you can click on it and it'll suggest topics or areas that you might want to consider. We'll talk about that a little bit later, and I'm going to show you a demonstration, but I will email you the roadmaps after. Of course, we built in rebates and financial recognition. So those employers that do participate in this optional program will receive rebates on their WSIB premiums, up to 75% of their WSIB annual premiums an employer can earn back. We'll talk about all of that as well. We're also aligned with the WSIB's rate setting framework, in that employers that improve their health and safety performance will receive an optimal rate premium rate through WSIB, meaning that you'll save more money over time. And then we've built flexibility into the program. So no longer are there going to be tight deadlines. You can join the program at any time of the year. It's a rolling entry program. And you can also tailor the program specific to your company's needs. We'll talk about that. So how the program works, at a very high level, we wanted the program to be very easy to follow, easy to navigate. So it's a very simple 1, 2, 3, 4 step process. So you'll see over the next couple slides this common join, develop, demonstrate, and achieve. So step 1 in the program, obviously, is to join the program. So this is an optional program by the WSIB. It's also the only financial incentive program that the board offers. So you may be used to receiving premium adjustments through MAP, CAD7, or NEAR. Those were all adjustment programs. Those were all eliminated in 2020, as if 2020 couldn't get any worse. We eliminated those. So the only way to receive any kind of financial rebate from the WSIB is through the Excellence Program. So as a little bit of context, the WSIB provides insurance coverage to about 315,000 employers in the province. We have a staff in my division, Health and Safety Services, a staff about 30. So there's no way for me to get out to all of the employers as much as I would like to. There's just no way. So in order to address that gap, what we did is we went to an open market system and partnered with 26 different WSIB approved providers. Our provider network is much like the cell phone system in this province. So you know that Bell and Rogers own most of the infrastructure. They own the cables, the poles, the wires, etc. And then you as a consumer are free to choose any carrier that you want to work with. Same thing with the providers. So there are 26 different providers across the province. And then you as a consumer, as a business owner, are free to choose any provider that you want to work with, depending on what their offerings are. So we have all of the health and safety associations. So you may have worked with IHSA or WSPS before. We also have private providers as well. So some people like 4S or things like that. All of our provider profiles are available online. It also talks about the different offerings of the providers. So when you're looking for a provider to work with, you're really looking for a partner. It's sort of like shopping for a car. So when you're shopping for a car, you're looking at the different features and model levels of different things. So same thing with a provider. Are you looking for someone who only operates online, or do you want someone who's going to come out on site and help navigate? Do you need someone who's really going to be involved, help write your policies, help do your training, really bring you through step by step? Or maybe you already have a system in place and you just really need someone there who's going to cross the T's and dot the I's. So it's the same thing. So the providers will charge an administrative fee in order to enroll in their services. The typical charge for providers is about $400 to about $1,200, which is usually only a fraction of the rebate that you'll get back through the program. And it's typically dependent on the premiums that you pay to WSIB. So a large employer likely will pay a little bit higher enrollment fee versus a smaller employer. So that's the first step, is to navigate those providers. And if you have questions about providers, I'm definitely here to help. And we actually are lucky enough to have a provider on the line. We might let them talk a little bit about their system a little bit later. But once you find the provider or partner that you want to work with, that's when the system really starts. So you're going to be emailed a link to a health and safety assessment. So this is a 20-minute confidential assessment that only you will be able to see. It's going to ask you some pretty simple questions like, do you know what a hazard is? Do you know what this green book is? If you don't know what that green book is, it's probably the end of your assessment right there. But depending on the maturity of your system, it'll ask you some questions about your current health and safety program that's in place. Once you've completed that assessment, our system is going to recommend areas of improvement or some topics that we think you might want to work on based on your responses. At the same time that you're doing that assessment to sort of determine your needs, we're also going to give you the opportunity to send out a confidential culture survey to your employees. And what this is a survey that was developed by the Institute of Work and Health. It's a very simple 13-question questionnaire that your employees can fill out to get a snapshot of their perception of your health and safety system. Where do they see the gaps? And that's really good information for you to know, because it's going to help get your employees involved, and then help you again determine, okay, where do I as an employer want to start making some improvements? In addition to getting the confidential rolled up data from your employees, we're also going to give you the aggregate data from your industry sector. So you can see the biggest gaps in your industry sector, see how are you comparing to other companies. And again, this will help you sort of compare to your competitors, and then you can use that information again to see, do I want to develop in conjunction with the industry, or am I doing better or worse than my industry? So you can use all of that information, the culture survey, the assessment from WSIB, and some advice from your provider to determine which topics do you want to work on. So we're going to go back to those 36 topics. So this is a very high level view of the entire program. So as I said, there are 36 different topics, and the topics are divided amongst program levels, starting at level 1, which is our foundational level, where there are 10 topics. So these are going to be your pretty basic or foundational level things like first aid. We'll get into them. And then as you move into level 2, your intermediate, there's an additional 17 topics, and then into level 3, advanced, with an additional 9 topics. So the system is designed that if you were just starting out in health and safety, you would start at level 1 with your knowledge of basic health and safety requirements, meet those little legislative requirements, and then as you move your way up through the system, up through the levels, you'll put yourself and your business into a position of excellence where we are aligned with the best practice and standards already. So we are aligned with the Chief Prevention Officer's accreditation program. We are aligned with other health and safety management programs like the IHSA's core program for construction. We are aligned with international standards, ISO 45001, the Canadian National Standard as well. So meaning that you can use the Health and Safety Excellence Program as a vehicle for other accreditation and standards. Ours is the only program that gives money back. And we'll talk about that as well. So here's the topics in level 1. So as I said, there are 10 topics in level 1. You can see on the slide here, you're probably doing most of these things already. So we've got things like leadership and commitment. That's going to be your health and safety policy statement. You've got things like health and safety communication, first aid. These are legislatively required topics that you're already doing that you're not getting credit for. So it sort of makes sense that if you are needing to improve your system or you have some questions, it might make sense to enroll in the program, get that financial recognition for work you're already doing, and then get some money back. One thing I want to point out on this slide is the 4th topic from the bottom, the control of hazards topic. This is a unique topic because it's actually repeatable. So you can repeat this topic for every hazard that you've identified in your workplace. So let's take a construction company, for example. Off the top of my head, I can think of 100+ hazards on a construction site. You can actually complete that control of hazards topic for every hazard that you've identified over and over and over again, and get the financial rebates, okay? It's also topical right now because COVID-19 is a workplace hazard. So the work that you've already done, if you've maintained your business open throughout the pandemic, you've already had to put some control mechanisms in place, whether that be safe work practices or source control with masking. You've already done some control of hazard work for COVID-19. We will recognize the work you've already done for COVID-19 if you enroll in the program, and you can help offset some of those costs. As we move into level 2, there's additional 17 topics. You can see here that these are getting a little bit more advanced. So you've got corrective action, you've got your contractor management program. So those are going to be your subs, legal requirements. We're also suggesting some topics be completed concurrently. So you can see we have 3 different return to work topics, but if you are developing a return to work program, it sort of makes sense to do all 3 topics at the same time. So you could select all 3 topics, do them together, and get the financial refunds. Again, that's suggested, it's not required. As you move into level 3, these are going to be our most advanced topics. So we've got things like internal and external topic, corporate social responsibility. These are likely the topics that are going to be selected by those employers that are looking to be accredited or already have a health and safety management system in place. And it's going to take a little bit longer to implement these topics. Now, what's interesting about our program is that you do not need to start at level 1 and move your way up through to level 3. You can choose topics within any level, depending on what you want to do. So if you're just starting out in health and safety, it's your first day, but you want to pick all level 3 topics, you're free to do so. So an employer is free to choose between 1 and 5 topics within every program cycle. An entire program cycle is 365 days, meaning you can pick either 1 or 5 topics and work on those topics for the full year. But because it's a rolling entry program, you can join the program at any time. So if you wanted to join in the fall, it would be 365 days from the day you join. Okay, so that's step 1. Step 2 in the program is to develop the program. So this is a light slide, but it's actually the meat and potatoes of the entire program. So this is where your provider is going to come in, and this is really where you're making the improvements. So you've now selected your 1 to 5 topics, and you're now implementing them at your worksite. So depending on the topic you've selected, let's go with first aid. It might be, getting your first aid requirements, checking out regulation 1101, seeing who needs to be certified. Do I need to have kits in cars if you're providing company vehicles, et cetera, providing your training, okay? Pretty easy topic. You could likely get that done in about 90 days. So the minimum time frame that we're going to allow an employer to implement a topic is 90 days. But if you're picking a more heavy topic, like corporate social responsibility, for example, it's going to take you a lot more time. So we're going to allow an employer up to 365 days to implement the topic. And this is why it's really important to choose a provider that you're comfortable working with, because this is where they're really going to come in and help you implement those topics, either write your policies, procedures, do your training requirements, really help make those topics live and breathe at your workplace. Okay, so once you've implemented the topics, that's when you would move into step 3 into the program, which is to demonstrate that you've made the improvements in order to be eligible for your refunds. So anybody who did take part in our previous incentive programs would know that in order to get your refund from WSIB, you would have to go through a health and safety audit. So I would come on site, I'd spend either a day with you or a couple of days with you. I'd go through your entire health and safety program, look through your training records, nitpick everything. It would be like a CRA audit. We'd go through everything. You'd be pretty sick of me by the end of it. And obviously employers didn't have time for that or didn't enjoy that. So we've thrown that out. And what we've now done is we've moved into a self-attestation model, meaning that the employers will need to self-attest that they've either made the improvements, that they've met the topic requirements, or they haven't. And then with that self-attestation, they will need to submit some type of evidence to show how you went from point A to point B. But the evidence is really up to you to provide. So we're going to let you choose how you want to show us how you made those improvements. It might be you're going to want to show us a video, maybe of your supervisors doing some safety talks, or it might be copies of your policies and procedures. It might be a picture, depending on the topic. Maybe you're doing a lockout, tagout program. Maybe you're going to show us your procedure and then a video of somebody actually following the procedure. We're going to really leave it up to you. You're going to submit your evidence online onto our digital platform, and it will be sent to a WSIB validator to review. So it'll come to me, I'll take a look at it. All of our validators are health and safety professionals. So like I said, I'm a member of the Canadian Society for Safety Engineers. We have industrial hygienists, safety consultants. They will take a look at the evidence to determine that your program meets the requirements of the topic, any legislative requirements, and any best practices, and they will determine yes or no, you've been successful. If we've identified gaps when we're taking a look at the evidence, we will give it back to you with suggestions for continuous improvement, and you will have 60 calendar days in order to bridge those gaps. So if you're able to bridge the gaps within 60 calendar days, you'll still be eligible for any refunds that you're entitled to. If unfortunately you're not able to bridge the gap within those 60 days, there is no penalty. You're still entitled to any rewards for any topic that you did complete. And then the incomplete topic, you could carry over to the next year and continue working on that if that's something that you wanted to do. Okay, so everyone will go through that sort of initial view. But a little bit more, I talked about the sort of desk validation. Every participant will go through that. It's not an audit. It should be a positive experience. In addition to that, a small number of employers will be randomly selected for on-site validation. What on-site validation means is I'm going to come on site, assuming we're able to do so through the pandemic. Now, again, this is not an audit. So what it is it's an opportunity for you as an employer to take advantage of the validator's health and safety experience. We're going to give you recommendations for continuous improvement to help build your program. So it's actually a positive experience. It's basically free consulting. And then again, when we are on site, if we do identify any gaps in your programs, you will still have that 60 calendar days to make those improvements. Okay, so I know this is a lot of information, but we'll take a break in a second. The last step in the program is step 4 and to achieve. So you've now selected your 1 to 5 topics, you've implemented those topics, you've shown your evidence to WSIB, and you're ready to earn back. So for every topic that you successfully complete, you will earn a rebate on your premiums. And we're going to get into the actual calculation in just a minute. In addition to those financial rebates, if you are a Schedule 1 employer, so Schedule 1 employers are 95% of the employers. If you're a Schedule 2 employer, your government, a school board, et cetera, Schedule 2 employers will not receive a financial refund at this time. You will only receive non-financial, but everybody else will receive the financial refund as well as non-financial recognition. So for the first time ever, like I said earlier, WSIB is going to publicly recognize and support your brand if you're enrolled in this program. So we're going to give you digital tools that you can use on your email, your website, your letterhead to show that you've invested in health and safety. And we're going to put your name on our website as someone who's enrolled in the program and invested in health and safety. So this is going to provide you with a few advantages. It's going to give you a competitive edge to show, between you and your competitors, if you're aligned with WSIB Health and Safety Excellence and your competitor is not, and you're looking for a bid for contract, for example, most likely the person is going to choose that company that is aligned with WSIB. You're also going to be able to show your employees your commitment to health and safety. So if you're attracting top talent, most people want to work for a company that takes their health and safety seriously. So if you can show that you're invested in health and safety, you're aligned in the program, you're likely going to attract top talent. You're also going to attract investors, because investors are going to invest in companies that don't have as much risk. So they're going to want to mitigate their own liabilities, their risk. They're going to want to invest in companies that have health and safety programs in place. So I'll show you a little bit more about what the public recognition looks like a little bit later. But we're also continuing to build on our public recognition program. We're looking at printed decals for your trucks and things like that to really help support your brand and promote those employers that do participate in the program. So let's talk a little bit about the rebates. So in order for us to talk about how you're going to calculate your rebate, I have to introduce you to Compass. So for those employers on the line that don't know what Compass is, it's a free tool that's available to all employers. Okay, so Compass is where you're going to find your firm's individual health and safety performance information and your premium information. So this is a free tool. It's available to all employers. You would go in, log in, so Login, log in at WSIB.ca, and then click the tool that says Compass. There are two types of Compass available. There's an inward-facing Compass and then an outward-facing Compass. So WSIB does publish open source data for all of its employers, meaning that any member of the public can type in any company if they are covered by WSIB. So say McDonald's, I could type in a McDonald's on Bank Street, and I could see how many claims they have, how many types of injuries they have, how are they performing in comparison to their other competitors. So that, again, that's public facing. But you as a business owner have access to your inward facing Compass, which is going to show you claim specific information. How many mental health injuries do you have? How many occupational injuries do you have? Who's still on claims? How many claims have you had over the past 7 years? How much do those claims cost you? What are your costliest types of claims, et cetera, et cetera. So you can really get into the nitty gritty of each claim. So if you know that Sam hurt, her wrist in January and she's still off work in October, what's going on in that claim? So you could do that. It's also going to show you your financial information. So your premium rates for this year and where your premium rates are going over time. It's also going to show you something called predictability. So if you don't know what predictability is, when we moved to the new rate setting framework in 2020, all firms were assigned a predictability level. And that is simply your firm's individual ability to influence the overall insurance system. So very briefly, an employer with a lot of employees, a lot of claims, if they do really well, they're going to bring the cost of the overall insurance system down. So they have a high predictability. We know reasonably well how they're going to do. But say a small employer, someone who's never had a claim, if they do have one claim, their insurance rates could skyrocket. So they have a low predictability. Okay, I only mention that because you need to know your predictability level in order to determine your premium rebate through our program. So if you're not using Compass, I would highly encourage you to do so. It's a very valuable tool, especially for your return to work program, your claims management program, as well as for your accountants to know, how are your premiums going to be affected over time. So again, that's at login.wsib.ca. Okay, so back to the Health and Safety Excellence Program, So you only need to know 3 things in order to determine your potential rebate. You could do this today if you wanted to. So all you need to know is your prior year premiums, that predictability level that I talked about, and then the number of topics that you want to select. So we've upfronted the refunds. We've made it of greater interest to those smaller employers up front, because larger employers will have a larger downstream effect in the program. We'll talk about that a little bit later. So when you're calculating your rebates, you need to know your predictability level. So if your predictability is greater than 20%, you're going to receive back 1.4% per topic that you complete. If your predictability is less than 20% or equal to 20%, you will receive 2% back per topic. Okay, so in this example, we have an employer that pays $200,000 in premiums. They have a lower predictability, so they're going to get that 20% back times 5. So they're getting overall 10% back. They're going to get $20,000 back. Okay, if you have a firm, just as another example, that's paying $7,000 in premiums and the 2% back, you're actually going to get $5,000 back. And that's because we've introduced a minimum amount of $1,000 back per topic, up to 75% of your annual premiums. So if you have a small employer, say they're only paying $1,000 in premiums, you know, and they were to do this and to get 2% back would be almost, you know, nothing, $200. They're actually going to get $750 back because of that 75%. Okay. We've also introduced a maximum of $50,000 back per topic. So if you were to choose $5 at the maximum you could, 5 topics at the maximum, you get $250,000 back per year, which is the maximum. So you can see already that the potential rebates to this program are much higher than your, you know, enrollment fee of $400 or $1,200 or whatever it is going to be. So you can get all of this information on Compass. You can check your prior year premiums, your predictability, and then it's a simple calculation based on the number of topics you want to complete. If you have any questions about that or questions on where you can find your predictability, I'm going to send out my email after this. I can help you determine what your rebate would be and how you can find that information. Okay. So a little bit about the public recognition. So we're going to give you those digital tools. Like I said, we're going to give you badges that you can put on your email, letterhead, website, etc. So you'll, just for enrolling in the program, you will get a membership badge that you can display that show you are a member. We're also going to give you performance badges. So for every topic you complete and every level you complete in the program, you'll get additional public recognition in those badges that you can show to your employer. That information will also be posted, like I said, on our website to that public facing registry. So anybody who types in that business name, they're going to see whether or not they are enrolled in the program or aligned with health and safety or not. Okay. So I'm just going to pause there for a minute. I know that was a lot of information. So just to see if there's any questions at this point, see if anybody, you know, has any questions about predictability or the program in general. Lynn, I'm not sure.
Tyler, we have one question that was posted in the chat. It's not specific, I don't think, to anything you've talked about, but I think it's a brilliant question. And
Sure.
Lise wanted to know what the responsibility businesses have for employees' health and safety in their work at home environment.
Great. Yeah, that is a really good question. So that's an interesting question because the home environment is actually not covered by WSIB or the Canada Labour Code. So it's not considered a workplace. But then when we moved to working from home during the pandemic, things changed. So as an employer, you are responsible to ensure the same health and safety oversight as you would as any other employee in your workplace. So say if you have to identify hazards, you have to make sure that, you know, your employees are working in a safe manner that's consistent with the Occupational Health and Safety Act. So that means, you know, you may have to do some type of risk assessment. You need to make sure that you have an ergonomic assessment in place if that's something that your employee asks for. So to be very brief, and we can take this offline if you want to, you have to provide the same level of oversight that you would as any other employee at this time. Okay. Hopefully that answers the question.
It does sort of, but could, I mean, that's huge.
It is. So that's what I say. So this is actually a huge topic. We could take this offline.
And I
so
just wanted, if you could perhaps put in the chat or follow up on where this is documented, as well as the requirement to have pandemic plans. Because these are all fine for me to sit here and think, oh, it's a great idea, but to sell them to senior management, I can need the evidence that, yeah, we do need a pandemic plan. And yes, now we are responsible for people's health and safety in their home work environment. Because that might put people back to work pretty darn quick.
For sure. So I'm actually glad you brought that up. We are going to talk about that. I'm going to give you some links and resources later.
Great, thank you.
But, yeah, no problem. Any other questions?
I think that's it for now, Tyler.
Okay. Anybody, while on the phone, you want to raise your hand or chat? I'll just give it one more second. Okay, great. Okay, so I know that was a lot of information. So we're going to take a little bit of a break in that regard. We're going to talk about the provider. So we actually are lucky enough that we have one of the providers. They did provide me some information. They're on the line right now. So like I said earlier, there are 26 different providers that you can choose from. One of those providers is actually 4S. And I believe we have 4S on the line if they want to talk about their program. Just talk a little bit about what the role of the provider is. Just one second. Addie, I believe, is on the line. Addie, are you there? Yep.
Yeah, great. I hope everyone can hear me. That's great. So first of all, thank you very much, Tyler. And thanks a lot, Lynn and the Ottawa Board of Trade for giving us the opportunity to actually explain and share some of our views on the Health and Safety Excellence Program, which is one of the greatest initiatives taken by WSIB, proven even more under the testing times of COVID-19, how important it is to have a health and safety program and get rewarded and incentivized for it. So as Tyler mentioned, the program runs through WSIB approved providers such as us. 4S Consulting is one of the WSIB approved providers for the Health and Safety Excellence Program, for delivering the program and helping with the topics. What is 4S? I'll just take a minute to explain. 4S is a company that was launched in 2004 with 15 plus years of experience in occupational health and safety training, consulting, and online software, that's online safety management system. So we cover the three major pillars of occupational health and safety. So when someone comes to us, we provide integrated health and safety solutions to help you move towards workplace safety culture, which is extremely crucial, which is also the objective of the Excellence Program. So what's the cost of the program? Before that, we call the program for Safety Excellence Virtual Support. So given the COVID-19 situation, virtual has become a reality, I'd say virtual reality. And that's where 4S comes in very handy, because 4S has got an online management system and a very good virtual model to help clients. So how does a program, how much does it cost? Like Tyler mentioned, it's around $1,000 plus HST per WSIB firm account, up to a premium of $1 million. And I'm sure most of you on the call today will be paying either that much or maybe less than that. But if there's someone on the call is paying more than $1 million premium, there is an additional 0.1% of total premium that needs to be paid. So the $1,000 per WSIB account is a simple charge that we ask for. And what do you get when you pay the $1,000? We help you select the topics. So we'll help you, we'll first understand your health and safety program, where you are currently, and where are the places where you have gaps and what you require. Based on that, and based on the health and safety assessment that Tyler was talking about, which automatically recommends you certain topics. So we try and help you with selecting a particular topic or topics that you want to, as Tyler said, 1 to 5 topics is the maximum you can select in a year. So we'll help you right through the process. And the action plan approval, crucial. 90 days is the time you have to approve an action plan from the day you select a topic. So we will work with you to take care of all the requirements set out by WSIB under the Health and Safety Excellence Program that you need to meet in order to go in for the validation. So we will work with you and complete your action plan. And then program admin support, including training and sharing of best practices. That's something we always provide. As a provider, we are right there with you right through the journey, ensuring that you cover cover every bit of what's required by the WSIB. And review of topic completion and evidence, crucial. You've completed all the requirements with us. Okay, we've helped you build your topic and action plan. But reviewing it is extremely crucial before we go in for the WSIB validation. And 4S also helps you with a self-validation tool. So you can very easily see if your validation is up to the mark and where are the gaps, and you can prepare for your self-validation based on the topic completion levels. And if you require any additional consulting services, such as, for example, let's say you have a very good program in place, but let's say you do not have a policy and procedure for confined spaces, and you have a requirement for working in confined spaces. So we can definitely help you in writing the confined space procedures, or with additional training requirements. If there's a compliance requirement for training, we are CPO approved providers for joint health and safety training and other things. So we can definitely help you with all that for an extra cost. That'll be over and above the $1,000. But the $1,000 clearly includes the topic selection, action plan approval, reviewing the topics, mentoring you. And one of the key things with 4S is we've got extremely experienced ISO 45001 lead auditors and core auditors. Core is certificate of recognition, which is administered by the IHSA. So we've got external core auditors and external auditors for the ISO, or the lead auditors for ISO, who will be working with you, mentoring you, because the whole objective, I would say, that the underlying cake, the piece of cake, is the rebate. But our objective is larger than the rebate, and I'm sure WSIB's as well, is to get you to build a safety culture. That is the overall picture, and we will do everything we can to support you and guide you towards working on a safety culture, which is crucial, so that you keep on top of your program and you keep getting rebates year after year until you complete your 36 topics. So that's pretty much it as far as 4S is concerned. We cater to different industries. If you have people from manufacturing industry, people from construction, we have clients coming from different services, hospitality, and all kinds of sectors to support them with the health and safety excellence program. So we have a very simple model of group meetings, along with one-on-one correspondence when required. So and everything can be done virtually given the COVID-19 safety requirements. So, and if you require consulting support in person as well, we can provide consulting support in Ottawa if required, but we are trying our best to keep it virtual as well as physical where required, given the safety requirements are met. So that's as far as for Safety Excellence Program is concerned. And thank you, WSIB, for actually talking about this program, because one thing that Tyler might want to add to, and a lot of participants on the call might want to hear about, is how a WSIB Excellence Program can actually help you with your COVID-19 efforts. And there are, I think, 5 topics, if I'm not mistaken, right, Tyler?
Right.
That you, yeah.
Okay,
that's
thanks.
Something, yeah.
Thank you, Eddie. I appreciate it. Just in terms of time, I'm just going to move on, but thank you for taking the time to be on the call. So like I said, so 4S is one of the 26 providers. I will share a copy of this presentation with everybody. You'll have access to this slide, as well as all the other 26 providers, 25 providers. You can reach out to me as well if you have questions about the providers. Okay, so we're going to keep moving just in the interest of time. So we're going to talk now specifically about COVID-19. So this is going to lead into exactly what Lynn was talking about earlier. So if you're on the call and you haven't yet looked at the industry-specific guidelines for employers, there are some really good resources on the Ontario.ca website. So these guidelines were developed in partnership with the Health and Safety Associations, the Public Health Agency, and WSIB. They are industry-specific guidelines to implement and control your COVID-19 response. So this is where you're going to see that they are now required in writing in order to be compliant with the Ministry of Labour Training and Skills Development. If the Ministry of Labour Training Skills Development, if their inspector comes online, they're going to want to see that COVID-19 response policy in writing. So if you don't have one yet, this is a good place to start. So you can go online to these websites. These links will be hot linked. When you get the presentation, you can go there, check them out. These guidelines do follow the RACE model, the RACE model, which is recognize, assess, control, and evaluate. So the first step, obviously, in this program is to recognize the risk and the amount of hazard that is going to be at your workplace, assess that level of risk, control the risk. So you've probably done this already. Like I said, you've probably done some physical distancing. You might have done some source control with masking. Maybe you're doing a temperature check or something like that. You probably have the barriers. And then the most important piece is your continuous evaluation and improvement model. So how are you continuing to improve on this? How is your program working, and evaluating that step? Okay. So that I just put that in there because these are required. Like I said, I will send you the links if you haven't seen these already. We also developed COVID-19 recovery roadmaps. So these are the roadmaps that I was talking about earlier. So we have 3 different distinct pathways available for employers. The pathways are the small business pathway, the medium and large pathway, and then the third one is for any employers that took advantage of the Ontario Togetherness Fund and retooled their operations to focus on pandemic. So maybe you are manufacturing and now you're manufacturing PPE. You can follow that pathway. Basically what these are, I'm not going to go into too much detail because I will email them to you, but these are interactive documents that will help you navigate the pandemic. So I'll give you an example of what the small business pathway looks like. So this is what you would get. You would get, again, this 1, 2, 3, 4 step. So first thing is to identify what step your business is at. So either you're at step 1, you're closed and you're still identifying that level of risk or identifying the hazards and you're not yet open. So if you were to click that level 1, it's going to open up a little bit more and it's going to ask you questions. Have you set up a control program? What is the level of risk you're in? And then it's going to suggest some actions for you to take. Maybe you're already at level 4. Level 4 would be you've maintained your business, you have a control program in place, and you're in that continuous improvement phase, that evaluation phase of your program. How is your program working? How are you going to be able to respond should a second wave come? So again, these are going to be clickable and open up, and it'll ask you some specific questions to navigate and offer you some advice. We've also identified 5 specific topics within the Health and Safety Excellence Program that will help you address COVID-19. So this is what Addie was talking about. So within our program, we developed the program with the pandemic in mind. So we have 5 specific topics that an employer can choose from if their focus is COVID-19. So for example, again, you've done most of this already. So risk assessment. So that's one of the topics. This is going to be how do you assess the risk of COVID-19 in your workplace, including moving back from home, back into the home office. What needs to be done? We've got control of hazards. So again, how are you, the COVID-19 is a workplace hazard. So how are you limiting the control? Do you have engineering controls, administration controls, source controls? A mask is a source control. We have emergency prevention and preparedness. So this is one topic that ensures that it will help ensure your business is ready to address any kind of emergency, including pandemic, but it's also going to be like fire, theft, inclement weather. Example, COVID-19 is just one emergency. Emergency response. So again, how is your company going to respond to the emergency and maintain your business safely? And then finally, the last one is workplace health promotion. This is actually my favorite one because this is, again, about that mental health. How are you going to empower your staff, improve employee resiliency in the workforce and throughout the pandemic? So what we mean by is you can address COVID-19 is that if you were to select these topics or you've done work for COVID-19, you can use work that you've previously either put into place and still get the financial refunds. So like I said, if you've already done this and you're just looking for a financial offset, you can consider joining the program, selecting those topics. You've done the work already. You just wait the minimum 90 days, submit to WSIB for validation, and get your financial refunds and your public recognition. But if you haven't done those things and you're wondering, how do I do this? These would be good topics to join the program, select these topics, use the provider network to help you implement your requirements. So WSIB has developed COVID-19 resources. The first one is our adjudicative response to COVID-19 claims. So this is a very heavy slide, but we know from employers are asking us, what happens if we have a worker who contracts COVID-19 while at work? Do I need to report to WSIB, or when do I report to WSIB? So the key of when to report or fill out that Form 7 is when your worker tells you that they believe that they contracted COVID-19 at work and they have a positive diagnosis. That's the key. They need to have that positive diagnosis. So because COVID-19 is also an occupational disease under the Workplace Safety and Insurance Act definition, COVID-19 is a dual reporting diagnosis. So you need to report to WSIB and to the Ministry of Labor if your worker tells you that they believe they contracted it at work and they have the positive diagnosis. So if your worker says, you know what, I've got symptoms, I'm going home to self-isolate and self-monitor, but they didn't actually go get tested, you do not need to report to WSIB. They would follow public health agency guidelines, stay home, and you would follow any other procedure for someone who is just sick. Okay, so whatever that is at your workplace. You could consider at that time filling out an optional form. It's called a Program for Exposure Incident Reporting form. This is an optional form available on our website. What it's going to do is it's going to speed up that incident or injury investigation phase of your claim investigation. So if later on the worker does get tested and then it is a positive diagnosis, it's going to speed up the claim for you and for them. It's optional. But because WSIB is going to be the ones who determine work-relatedness of the condition, we know that sometimes it's very difficult to determine the exact place where they contracted it, where were they exposed. So because of that, we are not going to allocate any claims costs to employers. So no claims costs related to the COVID-19 will be charged back to your claims account, and there will be no changes to your premiums in 2020 if you have any COVID-19 claims. Okay, I'll just pause there to see if anybody has any questions about COVID-19 claims specifically. Lynn, I'm not sure if there's anything in the questions.
I'm not seeing any more questions at the moment. Thank you.
Okay, perfect. Okay, so we have some other supports for our documents. We have those Ministry of Labor training, skills developments, guidance documents. I'll hot link them to you. We do keep a live update on our website, any changes to COVID-19. We have that adjudicative document in full if you want to read about how we're making claims decisions. We had a financial relief package in place, which allowed employers to defer payment of their premiums up until the end of this month. And then any new premiums are not going to come out until January. And then we introduced a whole new online suite of services. So because WSIB offices do remain closed, the best way to get in touch with us is online. So as employers, you can reconcile online, get clearance certificates online, pay your premiums online, chat with an agent online, file claims online. And then for your workers, they are able to access their claims documents online, file their claims online. They can chat with a case manager online now. So if you haven't taken advantage of those online services, they are available for you. We have some pretty robust documents as well for the Health and Safety Excellence Program. So our website is wsib.ca/health and safety, where we have the full program guide, the topics guide, a frequently asked section, and then those recovery roadmaps, which we will send to you. So just to sum up, I know we're a little bit over time here, the benefits of investing in health and safety. So as a health and safety professional myself, the last section on the slide is what's most important to me. Why is it important to you to have a health and safety program in place? You probably heard last week about that 22-year-old in Russell who was working on the solar panels. He cut through the live wire and was electrocuted. Fatality. That happened just down the street from me. As the WSIB's health and safety consultant, I get notified every time there's a work-related fatality. And unfortunately, lately, as we are moving back into opening up the economy, lately we've been getting fatality notices every day. So for me, you do not want to get that call. I call people too often and say, I'm really sorry to tell you, your husband's not coming home today. You don't want that call. It's important that your employees go home to the people that they love and the things that matter to them. And then you want to obviously improve your overall health and safety experience and improve your bottom line through the program. Okay, so again, I want to thank you for taking the time. Next steps is if you have any questions, my email and contact information will be sent out to you. We have our website, and then if you are interested in joining the program, receive your membership badge, and then start your journey through health and safety. So Lynn, I'll leave it open one last time if there are any other questions or if anybody has any comments. I'm glad to answer any questions.
Absolutely. Thank you so much, Tyler. And Addie, thank you for joining us today to add some extra perspective. I'll give everyone a moment to see if they want to put last minute questions in the chat or raise their hands. But I want to point out that even though Tyler said that, and I agree, the first and foremost is to keep your workforce healthy and safe. By doing so, you are going to improve your business's reputation and you are going to have an impact on your bottom line. So all of these lovely things come together to just make your business stronger. So this is an amazing opportunity for businesses right now to reduce some of their expenses, have a little bit more control over the money that's going out the door, and most importantly, keep your workforce safe and healthy and give them confidence about going to their workplace and making sure that everybody is just, you know, survives this pandemic. I think that's the best way to sum it up.
It is. Thank you, Lynn. That's excellent points.
So I do not see any further questions. I expect that our audience has a lot to digest in terms of information. Not only are we going to post this recording on our website so you can view it again or share it with other people, we're also going to send out the entire slide deck from Tyler, which is packed full of information. And don't forget to reach out to the Ottawa Board of Trade or to WSIB Tyler directly with your further questions. If you send them to me, I will make sure he gets back to you. This is just a great opportunity and it's just going to make your business stronger. So please take advantage of it.
Thank you so much, Lynn, for hosting. I really do appreciate it.
No problem. So on that note, everybody, and being mindful of the fact that everyone's time is precious, we'll end now. And I wish you all a great day and a healthy and safe workplace. There we go. All right.
Be safe, everybody. Take care.
Bye-bye.
Thank you, Tyler. Thank you, Lynn.
You're welcome. Thank you for joining us, Addie.
Bye-bye.